YouTube channel. So let me just make sure that we can do that, and we are recording now. So without further ado, I'll go ahead and turn it over to our greeter this morning.
Good morning, everyone. Good morning, everyone. My name is William Bradford, and I want to welcome you to this great tour. I'm a board member with Volunteers of America, and I have been a participant in one form or fashion with them for probably nearly a decade as either a committee member or volunteer, or now as a board member. A little bit about Volunteers of America for those of you that may not be as familiar. This organization touches the lives of thousands, not tens of thousands of people in the community each year. And so this is an opportunity to come together and kind of see what the services actually look like, to see the people that we affect and impact and those that we benefit, to meet the staff and the people that are actually behind the window making all of these great things happen. And so, my experience with Volunteers of America has been nothing but positive. We continually meet to try and improve our methodologies and to make sure that we are effective in the community. And we also work to ensure that we make the most effective use of our donors' dollars. And so while we're here and on the tour, please take a minute to look around, and I know that I say that virtually, but to look around and explore what we have to offer, and also to ask questions to our staff and to the other members that are very familiar with each of these services we provide. And so thank you for coming today, and we hope you enjoy the tour.
Good, thank you, William. This is Chuck Meehan. I'm the, well, there's a picture of me. Goodness gracious, where'd that come from? But thank you for being here. And William, thank you. I see that we have other members of our board of directors. And as always, I want to thank you for investing your time and your talent and all of you, your resources in our special work. It pays dividends. And as always, I thank you on behalf of those we serve who benefit from it. And to all of the rest of you who have taken the opportunity, carved out some time in your day to be with us on this online tour, I thank you for that. The purpose of our Hope Begins Here tours is to see the faces of the people we serve and see our work firsthand. And we're doing it a little bit differently, and we'll stay with this until we can get back to where we all want to be, and that is to be face to face and to really be able to interact in a one-on-one way with those we serve, with those who do this special work, and those who support it. Thank you again. Just to put in perspective what you're going to see today, and this is all about our South Pointe Place apartments, quality, affordable, safe housing for senior citizens, and we'll also do an update on our Adult Day Health Program, which is located in the apartment development there on South Pointe Place. That's the purpose of it today. But to put that in perspective with the organization, I just want to share a bit of information. Volunteers of America was founded in 1896, and so in March of 2021, special organization will celebrate 125 years of service. And at its founding in New York City in 1896, when Ballington Booth was asked, the founder of Volunteers of America, what is it that Volunteers of America will do? His response was, we'll do whatever needed and go wherever needed and do whatever comes to hand. And in layman's terms, that's just doing in local communities what needs to be done. We found our way to Shreveport in 1935, opened a shelter for women and children on Texas Avenue. And today, our special work is really focused in 4 areas. It's children and families living in poverty. It's people with disabilities, providing support so that they can enjoy a quality of life and live in the community. It's homeless veterans and senior adults. And today is we're focusing our tour on our services to senior adults. Certainly, like everything in our lives these days, COVID has had an incredible impact on our organization, and it's created what we've come to refer to as the gap of uncertainty, which is the resources that we need to do all of what we do. One of the things that is perhaps a surprise to many people when they're introduced to Volunteers of America is we're a large business, an organization with a $17 million annual budget, nearly 40 programs and services touching the lives of over 6,000 people annually. And we have 400 employees. And last year, we had 641 volunteers who provided over 23 hours of service to our organization. And some of you are on this tour today, so thank you for what you've done. When I mentioned the total budget, the $17 million, a significant part of that comes from government. But each year there is a gap between it, what it costs us to do all of what we do and what we receive from government. This year, when the board approved a budget at our annual meeting in June of this year, we projected that we would need to raise $2,450,000. What has happened is COVID has impacted. We have significantly increased expenses and some hits to our revenue. And so that's why we've referred to it as a gap of uncertainty. But what we have, when I can share with you today, is we've received just under $1.4 million towards that $2,450,000 that we need to receive between July 1 of this year and June 30th of 2021. So thank you for that. One of the things that is most important to this organization is a $17 million budget, 400 employees. That's not what's important. What is critically important is what happens to those people who need support find their way to us. And so our commitment is to measure outcomes in every single program and service that we do. And just to give you an example, many of you are familiar with our Lighthouse program. Last year, we served 644 children. 100% of those kids remained in school, an average grade point average of 2.75. And another thing that we're proud of, knowing that they live in areas where there is crime in many instances, 100% of our 644 Lighthouse kids had no involvement with the juvenile justice system. Thanks to the incredible work of staff and volunteers who commit to serving those kids and families in those areas. Now, enough of Chuck. What I'd like to do is get us to what you've come to see today. And that is to learn more about our housing for seniors and our Ballington Center, which is the Adult Day Health Program. The Adult Day Health Program, as I'm sure many of you have heard, was closed in March. The Department of Health and the Office of Aging Services, in looking at the data, decided that it was important to keep it closed. But that didn't stop us from addressing the needs in our Adult Day Health Program. So what I'd like to do today is next, I'd like to introduce Cassandra Brossi. She is our director, current program coordinator in the Adult Day Health Program. She's been at this a while. Schumpert operated the Adult Day Health Program until about 10 years ago when we took it on, recognizing that this was a growing need for senior adults. And Cassandra came from Schumpert to Volunteers of America and has been with us since that time. So Cassandra, I'll turn it over to you. And again, I want to thank all of you who have joined our online tour today. And Cassandra, take it from there.
Okay, thank you, Chuck. I want to welcome everyone to our tour. My name is Cassandra Brossi. I'm the program coordinator at the Adult Health Center at Ballington Center. As you know, the center is currently closed due to COVID-19. The Ballington staff is still providing significant and very important service to over 40 individuals. The service includes daily calls, home visit for some three times a week, for someone 3 times a week. One of those individuals who we visit received, his name is Mr. Lester. Mr. Lester is an 86-year-old veteran, which today is his birthday. He began attending the center on February 21st, 2020. He was the last person admitted before it became necessary to close the center due to COVID. His wife, Evelyn, was very happy that he was at the center because she wanted him to socialize with others and make friends. Unfortunately, he was only able to attend the center 13 days before we had to close our doors. But that does not stop our staff from helping him. Mr. Lester is currently visited by a registered nurse, Sherry, 3 times a week. She takes vital signs. She provides some much needed social interaction and emotional stimulation. And some days they even visit his favorite store, which is Lowe's. It's near his home. Although Lester and his wife, Evelyn, expressed a desire for the center to reopen, they know we need to wait to reopen when it's safe to do so for everyone healthy and safe, healthy, until it will keep everyone healthy and safe. The center is located inside the South Pointe apartments, which you'll get to hear more about. Now, I want to introduce the Vice President of Housing Operations, Linda Jarrett.
Thank you so much, Cassandra. And thanks so much to all of you for joining our tour of South Pointe Place. Before we actually talk about South Pointe, we'd like to share a little information about housing at Volunteers of America. You heard Chuck talk about our target population: seniors, veterans, the disabled, and children and families. We actually provide housing for most of these populations. In fact, Volunteers of America North Louisiana operates approximately 300 units in North and Central Louisiana. We believe safe, decent, and affordable housing is a critical first step to living well and becoming and staying independent. With that, I'd like to introduce our housing staff on the call. Chelsea Martin is our Regional Housing Director. She supervises property management staff and oversees housing operations for all of our properties. This includes keeping our funds coming in and assuring that we are compliant with all of our federal and state regulations. Jeannie Canode is our Director of Services. She supervises the service coordinators and the case managers who assure our residents have access to all community resources necessary for them to live a healthy and independent life. Paula Williams is our service coordinator at South Pointe Place and would normally be a part of this tour presentation. However, she's on vacation today. She does provide excellent service delivery to all of the residents. So now it's time to showcase all things South Pointe. You know, living at South Pointe is more than just having nice living accommodations. It does offer a beautiful, safe, and affordable place to live, but also brings socialization, which includes bingo nights and shared dinners, plus a caring staff that is always there to address concerns and their needs. It opened in July of 2015, fully occupied with a long waiting list, which continues to this day. There are 50 apartments, 49 one-bedroom units for very low-income seniors, 62 years of age and older, and 1 unit for the maintenance staff who lives on site. The total cost of this housing to the residents is 30% of their adjusted income. In order to live here, residents must be able to live independently. So services. Services include such things as helping residents access free or reduced cost medications, hosting health fairs, having chair yoga classes, and having the provision of free food boxes each month. All of these things come to the residents free of charge. The amenities include a large community room that is very inviting and the place to be when there are pie or ice cream parties or holiday celebrations. You'll often find residents working on puzzles, crossword puzzles, or just catching their favorite TV show. We also have, obviously, we have a laundry room and an arts and craft room that also has computers for those who do not have their own. We would be remiss if we didn't talk about how we're working to keep our residents safe during COVID-19. Signs on the front door remind those visitors that must come into the building to complete a brief wellness screening, to wear masks, and to practice social distancing, and always using hand sanitizer, coming and going. We're happy to report that we've had no positive COVID-19 cases among our South Pointe Place residents. So now it's my pleasure to introduce you to our South Pointe Place guest speaker. Miss Kay Bergeron came to Shreveport from Belle Chasse, Louisiana, where she lived all of her life until Hurricane Katrina showed up. So she was actually fleeing Hurricane Katrina. We all know how horrible that storm was for our state. However, it brought Miss Kay to us, which has been a tremendous blessing. We call her the ambassador of South Pointe Place. She represents all that's good in our residents, and we're so happy she found her way to us. So, Miss Kay, the show is all yours.
Okay, hello everybody. As you know, I'm Kay Bergeron. I've been living here for 5 years. And the way I found out about South Pointe Place is my daughter worked across the way from here and saw the construction. I did too. I thought it was going to be a hotel, and in a way it is, isn't it? Only we have a full kitchen. Well, a hotel, you don't get that. And so she put my name on the list and surprised me and said I was going to have my own kitchen. As you can see, it now is on the screen. And I know I go overboard with decorating, but I like to do it. And it's mine, you know, and that's the nice thing about it. Previously, I was living with my daughter after Hurricane Katrina. And now I'm happy that I've been living here. And like Linda has said about the functions we have in the community room, which is where you can come if you desire to socialize. Everybody needs a little bit of that every now and then. And so we have also movie nights. I didn't mention that earlier, but we have movie night, pie day, and ice cream day. And Paula Williams is our service coordinator. She works very hard to coordinate all of these things for us. And we just walk in and we get to enjoy it. And she's done all the work that goes behind it, and the volunteers that come and call bingo for us. It's all fun. And if you want to participate, fine. And if you don't have to. But I like to come, and it is fun. And it's just a wonderful, safe, and the firemen come also and give us seminars, the policemen. They have both said this is the most up-to-date, safest building for what we are. It's a residence. And that makes you feel good. It really does, because, you know, everything's not always perfect. But I feel very safe here. And I feel privileged to live here, because otherwise I'd still be living with my daughter, maybe, because, you know, that's the way it is sometimes for some people. You don't have the income to be on your own. So anyway, it's worked out fine, and I love my apartment, and I wish you all could come and tour it in person. But the pictures are nice, and you can see, you know, everything. that's in my apartment. I have room for anything I would want. You know, it's more than adequate, and I love it. And I hope I can see you here one day. Wouldn't that be nice?
That would be nice. And Miss Kay, you know, usually y'all, when we have these Hope Begin Here tours, y'all know we have these every month. And for a while now, they've been online since we can't be in person. But when we were in person, Miss Kay would always generously open her apartment to us. So some of you may have had the opportunity to walk inside, but if not, we wanted to show you how lovely it is, because she decorates beautifully. She has a lot of antiques, a lot of treasures, a lot of pictures, and so you can tell how nice it is. And we just appreciate you, Miss Kay, so much. You were actually one of the first residents that I ever met when I first started working for Volunteers of America back in 2013, because we opened South Pointe Place, as Linda mentioned, in 2015, and you were a part of our grand opening. I remember that. You were standing there as we cut the ribbon to this beautiful facility, because I believe, tell me if I'm wrong, but I think you were one of the first 5 residents to live in the facility.
I researched it again, and I was the 4th person to sleep in this building.
4th person. And I'm sure you remember the others who were in the building with you at that time.
Yeah, actually, one of the ladies was living on the same street I was with her daughter, like I was. We
Wow.
both moved here, and we live right near one another. I walk by her daughter's house every day and on Ockley, and I didn't know until I moved here. So I made a new friend.
That's so nice. And I think, okay, I know y'all have a South Pointe Place Residents Association. Is that right? Tell us a little bit about that.
Yes, we just all look out for one another, basically, is what it is. You know, and if you see anything that's not right on the property or something, you know, it's that kind of a thing. It's helpful. That's another little safety feature too.
Yeah, that's nice. And I
Look
know
out for each other.
Yeah. Well, thank you so much for being here. Does anyone have any questions for Miss Kay? Feel free to unmute yourself. Ask her, ask Linda any questions. We hope you've enjoyed learning more about South Pointe Place, and we'll just give you a few minutes, or you can even use the chat box if you want to type a question or just say anything. Please do so now. Oh yeah,
Well, a lot of what you saw, like some of the big paintings, were gifts for my 80th birthday.
Oh, so nice. Okay, Linda, you might be able to answer this best, or Miss Kay too. Carolyn Murphy said, "Are there meal plans for residents?"
There is not a meal plan to speak of. They can obviously have, I think Meals on Wheels does deliver to certain people, but we do not offer a meal plan per se to the residents.
We have kitchens. I cook my own food. I like it.
Yeah, and I know a lot of people too, that would be a great way to get involved during this time. A lot of people do deliver non-perishable food items to the residents, and we could get those food boxes out to them pretty easily. So that would be a great way just to help supplement some of the food, since many of them don't have a lot of income to spend on some of those types of things. So that would be a great way to get involved too. So many people have said, thank you, Miss Kay.
Yeah, I want to say one thing about all of you that have, whoever created Volunteers America. It is a wonderful thing. And all of you do your part, which is a very large part that we don't actually get to see, but you're there doing what you do, which makes all of this here possible.
Yeah.
And I thank you for it, and everyone here that lives within this building. I know they're grateful too.
Well, we appreciate you and we love that. We love to hear that. Thank you so much. And we do this work because, you know, we want to serve individuals just like you, Miss Kay. So you're the reason why we do this. So thank you so much for joining us this morning and sharing your story. We love to see you, and I know everyone enjoyed it. I'd like to invite everyone at this time to please remember that we have a tour next month. So our remaining tour for the calendar year of 2020 is next month on December 2nd. It's our downtown lighthouse. If you haven't already RSVP'd, please visit our website. You can see it down there, voanorthla.org/tours, and you can click RSVP. Please share this. Please share this with others, because that will feature a lot of our work that we're doing in children and families. And I know Chuck gave you some of those outcomes from last year earlier with our Lighthouse program. And so it's very important services that we're continuing to provide to kids, although even in our Lighthouse, we can't meet in person at some of our sites, but we're still reaching out and serving those kids in the best way that we can academically and providing cultural enrichment opportunities. So please come learn more about that next month. And we thank you. Thank you, everyone, for joining us this morning. We hope you've enjoyed it, and it's just been great. It's been a great 30 minutes to spend to see everyone. So thank y'all so much.
Thank you.
Thank you, Miss Kay.
Thank you all.
Thank you.
Bye, Jennifer. Thanks. Okay. Bye, everybody.
Bye-bye.
Bye.